everyone. I hope everyone is doing fine. So today we will be discussing about beta lactamase classification. Beta lactamase classification is broadly classified into Ambler and Bush-Jacoby classification. So what was the need of two classification? Simple, because the Ambler classification was structural based, whereas Bush-Jacoby was more advanced, it was functional based. In case of Ambler classification, we have four groups: A, B, C and D. In group A, we have extended spectrum beta lactamases, penicillinases and cephalosporinases. In case of group B, we have metallo-beta lactamases, and in case of group C, we have AMC beta lactamases. In case of group D, we have oxa-beta lactamases. We need not go in detail that what actually these terms mean. Eventually in further series we will be learning about them. Today I am just trying to combine both the classification systems. So what we are seeing here, in case of Bush-Jacoby classification, we have three classes: 1, 2 and 3. So group 1 is nothing but C of the Ambler classification. Group 2 is nothing but A and D of the Ambler classification, and group 3 is nothing but which is left, which is group B, that is the metallo-beta lactamases. So how they become separate? In case of the group C, A and D, they have a serine, that is a non-metal site, so they constitute the serine beta lactamases, whereas the group B, they form the metallo-beta lactamases because they are having zinc as the active site. Coming to the resistance mechanism. So how these resistance mechanisms work? Whenever we are studying this classification, we should keep three things in mind, that is the type of beta lactamases, effect of the beta lactamase inhibitor and enzyme family. So first we have to see what is the type of beta lactamases. I will be using terms like cephalosporinases, penicillinases and carbapenemases. So there is a small acronym I have kept for them. This is not the real acronym, just to concise I have made this acronym. Cephalosporinases is CE, penicillin is P, carbapenemases is CA. Second is effect of beta lactamase inhibitor. So we have two inhibitors which we will be seeing. So first is clavulanic acid and second is non beta lactamase inhibitor, that is avibactam. Third is enzyme family, which are nothing but the examples of these beta lactamases. Now we come to mechanism. If we see the mechanism, in group A, as we discussed, it belongs to group C of Ambler classification. So in that case, if we see the first point, that is what is the type of beta lactamases here, we can clearly see it is CE, that is cephalosporinases. It is inhibited by clavulanic acid. No, it is inhibited by avibactam and cloxacillin. Now we come to group 2. In group 2 we have A and D. In A we have penicillinases, cephalosporinases, ESBL and carbapenemases. They all are inhibited by clavulanic acid. In case of group D, we have oxacillinases, extended spectrum cephalosporinases, and the most important group here is carbapenemases. Why it is important here? Because it has an example of oxa-48 here. Why this oxa-48 is so important? Because hardly something will work against oxa-48. So far only avibactam is something which will be working against oxa-48. So carbapenemases, you can clearly see one is in group D, one carbapenemases is in group A and one is in metallo-beta lactamase, that is the group 3. In group 3 we are generally having carbapenemases apart from the cephalosporinases. So here clavulanic acid won't be working, but EDTA will be working because the active site is zinc. Now we come to the examples. So you can see I have marked it with red pen. In case of AMC, which is the group 1, there are two subsets, 1A and 1E. E we will be generally using for extended spectrum. So for extended spectrum acronym we have E. In case of group A, we have 2A, 2B, 2BE and 2F. 2A is for penicillinases, 2B for cephalosporinases, 2BE for ESBL and 2F for carbapenemases. So F we are generally using for carbapenemases. In case of D, we have 2D and 2DE. 2D is oxyacetylinases, 2DE is extended spectrum cephalosporinases. In case of carbaminomases, as I told before, that F word will be used, that is 2DF. Then in group 3, we have two subsets that are 3A and 3B. So 3A and 3B are for carbaminomases and cephalosporinases. I hope you are understanding. Now we come to group 1, how we detect them. So generally we have to remember few of the examples of each group. In case of AMC, the enzymes which are important are AMC and CMY. How we detect them? Cefoxitin will be less than 18 mm if we are keeping a disc on the Muller-Hinton agar, and it will be resistant. So we have to be careful that these are not the clinical breakpoints. They are cutoff values. But in case of cefepime, they will be sensitive according to the clinical breakpoint. In order to know clinical breakpoint and the cutoff values, there is another video. So in case of group 2, if we keep a beta lactamase inhibitor like ceftazidime clavulanic acid along with the ceftazidime, that is a third generation cephalosporins, 20 mm apart, we will be getting a difference of 5 mm between both the disc, and this denotes ESBL presence. Another way to know is by seeing cefoxitin will be resistant and cefepime will be sensitive, which is in contrast with the AMC. In case of group D, OXA are the enzymes which will be there, and OXA will be having certain number against it, like OXA 48, OXA 24, OXA 51. So different examples are there. In case of group D, we have mainly 3 examples like NDM, BIM, SIM. There are more examples like IND, IMP. So some of the examples you can remember. So in a nutshell, if we try to fill this table, we will be able to know what exactly we are talking about. So in case of first chart, we can see that it is resistant to penicillin only, and rest nothing, no resistance is there. So it belongs to 2A group. 2A means group 2, A is penicillinases. Now second is penicillin resistant, oxacillin is resistant, and first and second generation are resistant. They belong to 2B, that is cephalosporinases. In third, all are resistant, only BLBLI and carbapenems are sensitive. That means we are talking about ESBL, that is 2BE. And in case of ESBLs, we have two exceptions also. So one exception is astronome will be sensitive, that is seen in 2E group, and another exception is BLBLI will be spared, that is 2BER, which will be showing that BLBLI will be also resistant. Beta lactamase inhibitors will be also resistant. Then we have 2F. In 2F, BLBLI will be sensitive. You know which group we are talking about? The carbapenems which are present in the A group, that is KPCs. So in case of the KPCs which are generally present in Klebsiella, you can see that the beta lactamase inhibitor will be sensitive and rest will be resistant. There is one more dangerous class which is 2DF, that is our carbapenems of OXA 48. Everything will be resistant in it except the first, second, third generation cephalosporin, which might and might not be resistant or sensitive. And the last is astronome. Only astronome is working, nothing is working. What we are seeing here, it is 3A. 3A is metallobeta lactamases. So if we try to see what we can know, that if these are AMC, PET, cefazolin, cefoxitin, CTR, CAZ, cefepime and astronome. So AMC will be working on this chart shows that AMC won't be working for AMC won't be working for amoxiclav, piperacillin, tazobactam, cefazolin, cefoxitin, CTR, CAZ, cefepime and astronome. That means organisms which are producing this AMC beta lactamases, these drugs won't work on those organisms. which will be producing AMC. Generally, there was a past consensus which was telling that spice organisms are the one, Serratia proteus, indole positive proteus, and Citrobacter, Enterobacter. These were the organisms in which AMC was not working, but it has been changed to Hechias now, because studies have shown only less than 5% have been showing AMC in those organisms. Then in ESBL case, the BLBLIs will be working, but this zone of Cephalopolysis astronome won't be working. How we will differentiate? Foxetin will be resistant in case of AMC, and in ESBL it will be sensitive, and it will be vice versa in case of cefepime. That is, cefepime will be sensitive in the AMC and resistant in the case of ESBL. So what actually will work here? In case of AMC, avibactam and relebactam will work. In case of the ESBL, sulbactam, clavulanic acid, tazobactam, avibactam, vaporabactam, relebactam will be working. Hope you enjoyed this lesson. Any queries you can share in the comment box. Thank you.